Hello, my name is Amanda Landrian, and I'm a second-year MPH student in the Department of Epidemiology. I completed my global health internship in Nairobi, Kenya, where I spent 3 months working for Population Council on a girls' empowerment program called the Adolescent Girls Initiative Kenya, or AGIK for short. AGIK is a huge undertaking. It's currently delivering 4 different intervention packages to over 5,000 adolescent girls in 2 different marginalized areas of Kenya. The first are the urban slums of Kibera, located in the capital city of Nairobi. Kibera is said to be the largest urban slum in all of Africa. Most of its residents live in extreme poverty, earning less than $1 per day, where homes and businesses are constructed of cement and corrugated tin, often blazing the name of some U.S. megacorporation like Coca-Cola. The second study location is Wajir County, located in the northeastern area of Kenya, located on the Somali border. In many ways, Wajir can be considered Kibera's complete opposite. Whereas Kibera is super dense and overpopulated, the different villages that make up Wajir spread far across the region. Instead of cement and corrugated tin, homes in this arid, drought-prone region are typically made of mud, dung, and twigs. Unlike Kibera, which is quite rich in its ethnic and religious diversity, Wajir is predominantly Somali and Muslim, and its residents have some of the poorest health outcomes in the entire country. Here, 1 in 4 girls will never attend any sort of formal schooling. 98% of women have undergone female genital mutilation. 80% of women are illiterate. And it's not at all uncommon for girls to be married off before they reach the age of 18. In fact, 40% of girls will be married before the legal age of 18. On top of all that, it's also an area of Kenya known for its insecurity, as the terrorist group Al-Shabaab continues to wreak havoc along the Somali-Kenya border. It really is the epitome of a hard-to-reach population, making it all the more important and interesting that a girls' empowerment program would be implemented there. And in fact, AGIK is the first program of its kind being implemented in the region. And that it tailors towards girls specifically in a male-dominated culture and society is, to me, so powerful. Now, I wish I could tell you that I got to visit Wajir personally and meet with some of the girls, but I didn't. But that's the beauty of working with qualitative data, as I did during my 3-month stint at Pop Council. By interviewing members of the community who are involved in the program or impacted by the program either directly or indirectly, you're giving them a voice rather than simply reducing them to a number or a statistic. Instead, you allow them to participate in the story that your quantitative data may be telling. Now, as an epidemiologist, I'm required to tell you that I love numbers and data and statistics. But the work I did in Kenya showed me the true value in qualitative data, especially in the context of conducting a program evaluation. Without it, you would never learn of the strengths and perhaps more importantly, the weaknesses of your program. You may not have known how truly happy these girls are to be in this program, to finally be given opportunities that are usually reserved for the men in their families. I remember one girl, through tears, describing how lucky she felt to be in formal schooling for the first time at the age of 14. How she no longer feels bound to the pastoralist traditions of her ancestors, and how now she wants to become a teacher so she can educate other girls that are like her in her community. At the same time, without this qualitative data, you also may not have learned that false rumors are spreading through the community that the program is trying to convert the girls to Christianity or sell them to other countries, as was the case in Wajir. As one parent described, she had saved all of the money given to her through the program's household cash transfer, money that could have been used for food, water, shelter, clothing, her schooling fees for her other children, because she thought the money was being given to her in exchange for her daughter. She wanted to be able to buy her daughter back if and when the time came. You also may have never learned of a female mentor who leads one of the weekly group sessions with the girls, who was physically assaulted when a brother of one of her girls threw stones at her because he didn't like the family planning strategies that were being taught to his sister. These things were gut-wrenching to read. but they serve as an important reminder of the unpredictable challenges that will inevitably arise. Challenges that, if left unchecked, can undermine any success or progress that has been made as a result of your program. Or even worse, they can cause a deep-seated mistrust in the community, making them wary of any programs or organizations that wish to work in that community in the future. As public health practitioners, we must work diligently to adapt our programs to overcome the obstacles like those being faced in Wajir, always taking into account the human element and the specific political, social, and cultural contexts in which we're working. I'll forever be grateful for my time in Kenya, for the food, the language, the culture, the beautiful scenery, the wonderful friends I made, and the lessons that I took home with me. So I want to say Asante Sana. Thank you very much to Dean Hyman in honor of your parents, and to the other donors who so generously give so that myself and these other amazing students can have these opportunities and do the work that we're so passionate about. Thank you.